just going to take a very few minutes of your time just to bring you up to speed on an industry initiative that's been put together by about 5 or 6 publishers so far, very much in partnership with the CCC. And this is called patientACCESS. We actually have a logo now, which I'm delighted to put up here. So I'll just talk you through a little bit about the history of where this initiative came from. We originally had a project called patientInform. That was launched in around about 2005. And as medical publishers, we really wanted to give, to work with various health organizations to give really good information to patients. And so the project was set up. 12 health organizations are on board and are still working on board. And there's a wide range of participating publishers. So what happens is the health organization chooses an article that they think in one of the medical research journals would be of particular interest to patients. They write a detailed summary summarizing what the implication is of the article, and then they post it on their site. Publishers then give free access to that article for people coming in there. The problem with this was it proved to be immensely costly and somewhat difficult to get really good summaries written. It's not the easiest thing in the world to be able to translate research down to patients. And so it's ended up being fairly limited in scope and doesn't really meet the needs of the patient advocacy groups. I'm sure you've all heard, my child, spouse, I have whatever disease, and I really want to be able to read something that's of vital importance to me. So we evolved from patientInform to patientACCESS. And at the moment, this is in a trial. patientACCESS is an initiative where specifically patients and caregivers can get access to an article, any article in the journals that are part of this pilot project. They get access to those articles for either low or no cost. The service has been developed by the CCC. It uses their RightsLink service, so shout out to the CCC. Any publisher using RightsLink can easily bolt on this service. And the idea of the pilot phase at the moment is to test all the logistics, make sure it works, sort out some of the legal issues, and really assess whether patients actually want to use this, whether they do use it. The plan is to do a full launch next year, but just a quick update on where we are so far. What happens is the publishers put the link wherever they choose on their site to the patientACCESS site. Then patients can come on and register. They register directly with the CCC, not with the publishers. And it's really important that the CCC then anonymizes those patients so that there is no abuse of patient information in any way. In terms of access abuse, that's controlled by regular reports that go from the CCC back to the publishers. Publishers are charged a per download fee, and then those publishers can then choose to pass on a fee of some kind, whatever fee they choose, to the users, or they can make it for free. Typically, so far, it's either been free or up to around about $8. We have 4 publishers already live. And Elsevier and Wolters Kluwer are coming on board fairly shortly. So we will, by the end of the year, we'll have a number of these different sites up and running. And the implementation, where the links have been put, you'll be able to see how different publishers have implemented this and find out from them how they're finding the system. So what does it look like? I just pulled up one here from a Wiley journal. So you can see in the background here, this is the Access Challenge page. This is where it says you have no subscription to this. And if you click patientACCESS, you come up with the CCC RightsLink page. But this is a very specific entry into RightsLink, which is for patients, and then they have to either create or use their own ID. So far, the user feedback has been very positive. Certainly, the market response in terms of the users has been fairly immediate. Most of the publishers who switch this system on get usage very quickly. So far, there hasn't been any obvious cannibalization of sales, but I'm sure it's way too early to tell. I thought this was an interesting statistic. This comes from the CCC, is that pilot publishers are seeing something like 600 downloads a month, which is interesting. And the reports going back to the publishers allow publishers to determine whether or not they're getting any abuse. So this is the about to be launched patientACCESS site. And so if anybody is interested in finding out more about patientACCESS, I'd like to introduce Sue Kessner, who is in the audience. Sue, do you want to stand up so people can see you? So if anybody's interested in finding out about how they can get on board when patientACCESS goes live sometime next year, Sue is the person to see. And John Tagler, I think, who is also here, has been spearheading the patientACCESS website. So I can take a few questions if anybody has any questions, and I'll call on Sue if she can help. David, there's a microphone there.
David Hall, Nature Publishing Group. You can probably guess my question. What is the publisher download fee?
The publisher download fee is set by the CCC. I think you should talk to them directly, and that really covers their costs. The whole idea of the system that we've set up is to try and use something that's already there, that's already being used, and the CCC is passing on at cost to the publishers. The publishers can then pass on at costs to the users, should they wish, or at cost plus a little bit. It's entirely up to them. Any other questions? Thank you very much. Grace, next session.